One other thing is, once you've thought about your whole process, who it is that touches the patients at what point, and who is the best person to really have a conversation with your patients around centering, make sure that you have thought through what education does this person need in order to really explain group care well to them. Make sure that you give them a chance to practice. Maybe you think about the kinds of things you want to say to explain group care, and then maybe you model it in a staff meeting, and then you maybe have people pair up and do a little practicing with each other, pretending that one person's a patient, and then afterwards you can debrief. What did that person do to help you understand what group care is? Maybe what are some things that were still a little confusing to you, or things that they could have expressed more clearly? What are some things that person said to leave you excited about choosing group care option? So think about who needs what, give them a chance to practice those skills, and then don't think it's a one and done. I think no matter how good your recruitment and enrollment plan is, you will find once you start it that it's going to need some tweaks. So expect that. Don't feel like it's a failure if you've kind of identified some places where things are falling through the holes, and you'll tweak it, and you'll adjust. And then the other thing I would say is those people who are talking to patients, who are doing that recruitment, do it a little bit centering style. So it's not just you talking at the patients about this option, but you describe it a little bit, and then, so now that you've heard a little bit about this group care, what do you think? What are you thinking? Let's see what patients are thinking. If they've got some barriers, you want to hear about them, and then maybe you can give them some targeted information that is related to those barriers that might help them see their value. So if you've got a patient, for example, that's saying, this sounds kind of good, but wow, 2 hours or whatever the length of your group visit's going to be, that sounds like a long time. Well, then give some targeted information back to that. It sounds like a long time, but sometimes when you come to a clinic for a one-on-one visit, if we're running behind, it can actually take that long. And then you have all this wasted time sitting in the waiting room or sitting in the exam room waiting to talk to the provider. But with this, the whole time is beneficial. You're making friends, maybe you're having some snacks, you're getting so much more education, and you're learning from each other, as well as building some bonds. So the whole 2 hours that you're there is beneficial versus, maybe if you're just going for just a one-on-one clinical exam, you're there could be there for just a long, and only 15 minutes of that is really time that is beneficial to you. So think about asking those open-ended questions to hear what a patient's saying, so what kind of information does this particular patient need in order to fully make an informed decision around whether or not they're going to choose to do group care. And I think it's always really good to say, just just try it for 2 visits. If you don't like it, you can always go back to individual care. It's not a choice necessarily forever. But I think that if you come for 2 visits, you'll at least have a sense of what is this like, so you'll really understand what is it that you're choosing between. Because I can tell you about it, and I'm super excited to tell you about it because I love group care. But you're not going to really understand it until you go and you give it a chance.
Thank you, Liz.
You're welcome.
Thank you.
Thanks for asking me.
Yep.